everybody! How you doing? My name's Lady Weirdness, and welcome to another surgery game called Rhinoplasty. Ever wonder how celebrities look great? This is how they do it. I don't know. I found this and I thought it was interesting. Let's do this! Do Surgery Squad. Hi.
Welcome to Surgery Squad's virtual closed rhinoplasty surgery. I'm Dr. Susie.
Hi, Susie.
Today we will be performing rhinoplasty. It's what's commonly referred to as a nose job. In this cosmetic surgery, our patient is a young lady who's looking to change the shape of her nose. We'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing. Some surgeons will perform this surgery using a local anesthetic and sedation, which makes the patient numb and in a dreamlike state. I prefer to work with a patient under general anesthesia and completely asleep. What we're doing today is reshaping the bridge of the nose. Our patient feels it's too wide and doesn't like the hump on it. The thinning of the nose is called an infracture. I'll bet you can't guess what the widening of the nose is called. All right, I'll tell you. It's an outfracture. Some patients may also want the tip of the nose reshaped. That's called tipoplasty. But as I was saying, this patient only wants an infracture and some reshaping. Easily done. To begin this procedure, we need to open the nostrils as wide as possible. We do this with...
Heads above there for a sec. And let me have a look up there. Oh yeah, you got a lot of boogers up there. You need to fix that. Oh my
The retractor. Can you place the retractor in the patient's right nostril?
Oh, oh, it's that booger figure. Here, let me get those figures out.
Now with the nostril opened wide, we'll make an incision inside in a crescent moon shape. That will allow us to access the bones and cartilage that make up the nose structure. I've made the incision. Can you use the forceps to remove that portion of the nostril? Surgeons must be hyper-vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell.
Uh-huh. Oh my god, that nearly killed me when it stretched the nose. I wasn't expecting that. Oh my god, it looks like you have a toenail up your nose. Ma'am, are you aware of this? You have toenails up your nose? Oh my god.
To reshape the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome. We place the osteotome at the base of the hump and then carefully tap on it with a small rubber mallet. This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
Oh my gosh, that last part almost killed me. Oh my gosh, okay. Oh, you ready to get your face smacked, lady? Opa! Opa! Pa! Oh gosh, I hope it doesn't go right up into her brain. Oh no.
Now that the hump is loosened, we need to pull the bone and cartilage out of the nose. Use the tweezer-like forceps to slip it out of the incision.
There'll be a big piece of... Oh my gosh!
Now that the bump is out of there, we need to smooth the edges on both sides with a rasp. The space left by the bone we've removed is referred to as an open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them. Tap the osteotome once each time I reposition it on the left and right nostrils.
Oh, yeah. Oh. It's not so funny now. Oh, gosh.
Now that the bones are broken, I just take my fingers and reposition them to close the open roof. Because we made such perfect breaks, the bones slip right into place and the nose is perfect. A few stitches to close up the incisions, and then we place nasal airway splints in each nostril to hold things in place.
Your fucking
Steri
face
strips
is
go
bruised.
across the nose, and an external nasal splint is added to hold everything tight. Our patient will have some bruising and minor pain for a few days.
But her face
We'll
is
remove the splints in
bruised.
about a week.
That doesn't
Most
look
of
nice.
the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
Okay, wow, okay. Oh my gosh, that was amazing. I wasn't expecting that. Stretch it. Oh gosh, that was funny. You know what? I still got some time left. Why don't we do one more? Yeah. Hoop. Let's see. Hey, here's a good one. Braces. I used to have braces. It was awful, but it was fine, I guess. The worst part was getting them adjusted. So, well, there we go. Braces! Braces. Da-na-na. The funny thing was that they told me not to eat gum, but I found a way to carefully eat it when I had my braces. So I still got to eat gum. It's like, I'm a tricky girl, haha. But I knew what they meant by not eating gum, so. But yeah, it was so nice once I finally got them freaking off.
Welcome to Surgery Squad.
Hello.
I'm Dr. Jeff.
Hi, Jeff.
And today we're going to talk about braces. Those
Braces.
fantastic bands and wires that help straighten out crooked teeth.
Plastic bands were terrible.
Let's face it, most of us do not have perfect teeth.
Oh
Everyone's smile
that
is unique.
does not look
Some
good.
people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size.
That was me.
If your upper jaw is bigger than your lower jaw, that is called an overbite.
I have a very tiny mouth.
If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large
This
enough
was
for all
me.
your teeth. That is referred to as overcrowding.
I had overcrowding.
In all of these cases, the problem can be fixed with braces.
I have a little itty bitty
Braces
mouth.
are a series of brackets, wires, and bands that are used to
hated the
guide your
rubber bands that
teeth
you
back
hooked
into the
onto
correct
these
position.
things.
This improves looks,
It's
makes it
horrible.
easier to chew, and at times even improves speech.
No, it didn't.
Our patient today has what looks to be an overbite.
Hi.
We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Hoop. Boop.
Next, we'll take an impression of the teeth.
That always
We
felt
put a special
weird and
gel on the
tasted
bite mold.
terrible.
The gel comes in lots of terrific flavors, like candy cane and chocolate cake.
No,
Can
it
you
didn't.
put the mold in the mouth?
It never tasted yummy. Ever.
Great job. We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster
Clean
model of the
teeth.
patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
1 week later, 1 week later. I had an awesome orthodontics.
Our patient is back, and we're ready to put...
Hold on, Mr. Jeff. I wanted to say I had an awesome orthodontics. I absolutely loved. I didn't really like going to have my braces adjusted, but I absolutely loved going to the office because it was all Looney Tunes themed and they played really good movies. So I didn't care what they did to me. I was just watching TV. So and I loved it. I called them the Looney Dogs. It was awesome.
on her braces. In some cases, a patient
I
may need
hated
spacers
spacers.
placed between the teeth for a week to create more room for the bands. Our patient does
Oh,
not.
I hated
We'll
spacers.
start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
I absolutely freaking hated spacers with a passion. And the freaking sounds of the machines were terrible. Oh my gosh. It was very distracting. This is nothing.
Wow, what a marvelous job. I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces.
I hated those too.
They circle the whole tooth and have a hook on the outside of the tooth.
Not comfortable.
Slip the molar band over the tooth. We'll cement it into place later.
Oh gosh. I hated molar bands. I hated the spacers. They were just not comfortable, but after a while you get used to them. But in the beginning it was not comfortable. And
Now
I had
we
to
can
have
start
braces
putting
on
the
top
bonded
and
brackets
bottom.
on the rest of the teeth. We've placed a lip guard over the teeth to give
I
us
hate the
room to
lip
work.
guard. Oh,
Let's rinse off the teeth.
The lip guard.
Can you spray them with water?
The lip
I'll
guard
run the
felt
suction to
weird.
remove the water.
The lip guard always felt weird. It was so weird. Boop, 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 boop. Oh, I'm rinsing your mouth. But yeah, I had braces up above and down below. And I had to wear the freaking rubber bands in between it, so that when I opened my mouth, it pulled. It felt really tight, like I couldn't open my mouth. I hated it. Okay, bro, she's rinsed.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
Sure, bro.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Oh my gosh. Oh, the bonder always tasted terrible too. I remember that. Getting braces put on for the first time was awful. Once they're on for a while, it was not so bad. But getting them on was horrible. Okay, dude.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Boop, 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 boop.
I will
they
scrape
slide
off the
the
excess
wire.
bonding agent with a dental pick.
Don't get
Now
it.
use a curing light
There's no way
to
that
harden
they
the
get it
bonding
off.
agent under the brackets. Click to turn on the curing light.
Oh, I hate the curing light. Oh yeah, this is exactly what the machine looked like too. Oh my freaking gosh. It felt weird and it made it taste even worse. It was horrible. Like I said, getting the braces for the first time was horrible. After that, it wasn't so bad. Other than them having the wire adjusted.
Great job. Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket.
Oh
Let's
yeah.
slip the wire
Forgot
into the
about
brackets
that.
of the bands on the molars. Move the wire to the mouth to put it in place.
Oh yeah. The freaking ends of the wires. I'm gonna use my finger. These end of the wires always jabbed my cheeks, and I hated that. That was like the most constant problem with them, and I kept having to put wax on it, and it didn't work. So they had to keep like clipping the end of the wires shorter to make it more comfortable. Because I would have holes in my cheeks.
Good job. We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there
Clip
we
them
are.
short,
The arch
man.
wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we
yeah, you
snap
can get
over
them
the front of the
colored.
bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
Oh, these were the best part. The little rubber bands they stick over each one. Because you could get them colored each time they like change them out. So you could have like a rainbow of colors in your mouth. And that was like the best part. I always got green. Because green's my favorite. Green, 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 green. My mom always said it looked like I had salad in my mouth. But I didn't care. It was awesome.
And with the last ligature in place, our patient is done for today.
Yeah.
In the next few
Go eat
days,
ice
she
cream.
might experience some initial discomfort. She should plan on eating
Definitely.
soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort.
Doesn't
If
work.
there is a real problem, she can always call the orthodontist. It is important to take more time
Yep, I
brushing and
remember those.
flossing when you have braces, as food can get lodged between the wires and the teeth.
Yep, little
Our
floss
patient
picks.
will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer.
I remember
true
the
length will
retainer.
vary by
It
patient.
was horrible.
She might also need additional equipment such as elastic bands, coil springs, or headgear.
Oh,
We will
I
not
was
know until
lucky
we see
not
how
to
she
get
responds
headgear
to the
though,
braces.
or coil
There you have it.
springs.
The braces are in place, and our patient is on the way to a beautiful straight smile.
Yeah.
Thanks for coming by Surgery Squad. Why not check out one of our other procedures
Hey, we
here
just
on
did that one.
surgerysquad.com?
Hey, we just did that one. Oh my gosh. Yeah, I was looking at headgear of the coil springs. I didn't need any of that. But the retainer was horrible. It's like because it was like a kind of a downer moment. Like, I'm free from my braces. Now I have to wear this? What? And then after a while, my teeth stopped shifting and I didn't need the retainer, so I'm free from it all. But that's interesting. That's awesome. It brings back a lot of memories for doing the braces one. My gosh. Okay. Whew. Well, that was fun. I enjoyed that. I really did. I love this site. I love the Surgery Squad site. It is so much fun. Go check it out for yourselves. All their games are free to play, and you can learn a lot of things. So, anyway, thank you all so much for watching. If you liked it, high five that like button like a pro. And I will see you guys in the next video. Bye!